scan babies that have known abnormalities. We are a very specialized technologist, and what we do is very rewarding but also very challenging at times. For a baby, everything should be 10th or above percentile-wise, and Ethan was less than the first, which is not good.
She knew that the baby was very small and really didn't want any aggressive interventions until the baby got big enough that there would be an option of treatment after delivery.
If you deliver a baby too early, which I know from my job, they could have multiple complications and maybe not even survive that.
When very early growth restriction is diagnosed, the risk of complications during pregnancy or at delivery is much higher.
I came back about 3 weeks later and my world kind of got rocked. Got my MRI, and Ethan's placenta was not working appropriately. It's called placental insufficiency. And there's really not a lot you can do with that in pregnancy. It's kind of just a waiting game to see how long that placenta will last before you have to deliver.
And so we were doing follow-up ultrasounds and monitoring the baby's growth. And the baby was still very small, but was greater than 500 grams, which is sort of our cutoff where we start thinking the baby might have a chance if we need to deliver. And that's where we start monitoring blood flow through the umbilical cords.
We decided to do the blood flow through Ethan's umbilical cord, and I specifically remember Dr. Schubert saying, close your eyes, close your eyes. Because he knew that I would know what the sound of the blood flow would be and what it would look like on the ultrasound machine. So I closed my eyes, and as we begun, I immediately knew that Ethan's blood flow was actually reversed flow, which is the worst.
Knowing everything that had been going on with Ethan leading up to that point, that was sort of the decision for admission to the hospital for monitoring. And we do that in cases where we're worried that the baby might have to be delivered in an urgent fashion. We decided that we just couldn't wait any longer and that Ethan's birthday was going to be right then.
I was terrified because I knew I may have a live baby or I may not. Sorry.